YouTube, it's Marida, and welcome to another edition of the Nurse Lounge. In this edition, we're actually going to start our Nurses Week series, in which I do a video every single day for Nurses Week. Today is day 1. So, if you want to see the topic that we're talking about, if you want to see how I'm kicking off Nurses Week this year in 2021, stay tuned. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for almost 17 years. I am an OB/GYN well baby nursery nurse. I'm a nurse educator, as well as I work at a HBCU and I am doctorally prepared. Today's topic is the 10 medications you should know as a postpartum nurse. So yes, we're gonna jump right on into Nurses Week with something like this. I've never did a video like this before, but we're gonna go ahead and jump right in. These are 10 medications that you should know if you are wanting to be a postpartum nurse. You need to know these medications in and out. Now, with that being said, these are not all inclusive, meaning that these are not the only medications you should know about. But for sure, you should know these medications and what they're for and the side effects with them. I'm not going to go through all the side effects of these medications. However, I am going to kind of go through a little rundown about what we use them for and why it's important for you to know. Again, not all inclusive at all, which means these are not the only medications you should know as a postpartum nurse, but these are definitely some of the medications that I know I use on a day-to-day basis when it comes to taking care of my postpartum patients. This is specifically for postpartum patients. I will do another whole video on medications you should know as an L&D nurse. And I actually will do one for nursery as well, medications you know for a baby, the well baby side, a nursery nurse. So I will do those in another video, but this one is specifically postpartum. So I have them written down on this card right here, so don't mind me for looking down. I have my notes here, just help me stay organized. And the order that I name these does not mean anything. There's not an order to it. It's just how I thought of them based off of how I pass my medications. And I may throw in an extra bonus as well. So the first medication I want to talk about is Colace. So Colace is also known as docusate sodium, and we give those to patients who have had a baby. Now, why do you think we would give this medication to someone who's had a baby? For one, they've had a baby. Number two, we want to make sure that they are able to have a bowel movement with ease. So we give them, depending on the physician, either 1 to 2 to 3 a day based on the physician's order of 100 milligrams of docusate sodium. Again, this is to make the stool soft. This does not make you go to the bathroom. That is not what it's marketed for. Now, with that being said, if you take too much of this medication, it can give you diarrhea, and therefore you do go to the bathroom quite a bit. Once it starts to do that, then you need to stop taking that medication. Put that medication on hold for your patients. So, or skip that dose. Basically document that you skipped the dose or held the dose because of the fact that the patient has diarrhea is done over and beyond what it needed to do. Docusate sodium, the whole property or principles of that medication is to allow the colon or the intestines to absorb or keep the water. Therefore, it makes the stool soft, so therefore it's easier to pass. We don't want to get rid of that water, so we want to keep the water to make the stool soft. That's what it's for. We don't want our patients don't want to strain to go to the bathroom. Our patients are definitely having issues with constipation. Our patients are definitely having issues with, they're being fearful to go have a bowel movement because they have either had a C-section or stitches down there, and they don't want to bust open either one of those, which that won't happen, but that is a fear of theirs. Also, just the trauma of having a baby in general coming out the vaginal vault, if canal. for some moms is enough to cause them to have anxiety, enough to say, I'm going to hold the stool. So we don't want them to do that. I tell them when they need to go, the body says it's time to go, roll with it. Number 2, Motrin or ibuprofen. We give that to our patients like candy, okay? We either give 600, this is at my facility, we only give 600 or 800 milligrams of Motrin. Keep in mind, we give it either every 6 or every 8, depending on how it's ordered, either PRN or scheduled. Again, depends on how it's ordered. And know when it comes to ibuprofen that it is a daily limit. Once they have reached 3,200 milligrams a day, they have met their daily limit. They can't have more than that. So be mindful of that, okay? 3,200 for Motrin. The next one I want to talk about, number 3, is Percocet and Hydro. So oxycodone or hydrocodone, Percocets or Lortabs, or however you want to call them, they're narcotics. We give those out like candy as well. A lot of these medications, we just issue it out just like it's candy, okay? So keep in mind, they come typically for us, they come in either 5-325 or 10-325. 5-325 means 5 of Percocet or Lortab, and the 325 is of acetaminophen Tylenol, okay? That's what the other part is, 5 or 10-325. So if you have 5-325, you have 5 milligrams of Perc or Lortab, and then 325 of Tylenol. Or if you have 10, you have 10 milligrams of Perc or Lortab in 325. So be mindful of that. Number 4 is Tylenol. And also, that kind of goes along with the Percocets and Hydro. Know the daily limit of Tylenol is 4,000 milligrams of Tylenol per day. Now, why is this important when it comes to your Percocets and your hydrocodone or your Lortabs? It's because that 325 we just talked about, it factors into that 4,000 milligrams per day. So if you are giving them the Percocets or Tylenol or Lortab or whatever, you're giving them that, and then you turn around and have to give them regular Tylenol because they have a headache or because of some other reason, fever as an example, you have to keep in mind that is still added within your daily limit of your 4,000 milligrams per day. Number 5, Toradol. Toradol is basically an IV Motrin. So IV Motrin, you know, that's what it basically is, okay? But let me tell you, that medication right there, for most of my patients, works wonders for them. My C-section patients, my GYN patients take this medication if the doctor prescribes it, and they do so much better postpartum or GYN surgery, post-op, than not taking it or just taking a narcotic. So I always love when my physicians say, okay, we're going to give them Toradol, usually 30 milligrams, Q6 hours. Now, this is the thing. If they're taking Toradol, Q6, 30 milligrams via IV, they cannot have PO Motrin, ibuprofen. It's the same thing, okay? Basically, it's the same thing. So they can't have those at the same time. As a nurse, you have to know that. You have to know your medications, know you can't have both at the same time. So know that. My next medication is morphine. Morphine is a narcotic, as we know, and it causes, the same way with your Percocet and hydrocodone or Lortabs, it causes respiratory depression. So when it causes respiratory depression, that means our heart rate, our blood pressure, our respiratory rate, O2 sets, all that can go down based off these medications. Plus, of course, it's a narcotic, so it can cause constipation if you get this like around the clock type of thing. So be mindful of those things. Morphine specifically has side effects of headaches, itching, nausea, vomiting, things like that. So if you have your patient doing those types of things, be mindful that those normal side effects. That is not an allergy. That's a side effect of the medication, which is normal. So know your morphine, know your dosages, know how much is appropriate to give to your patient population. Every physician orders that slightly different, so I won't get into our dosage at all, but just know that you need to know about your morphine. Next, number 7. Number 7 is Methergin. Methergin is usually given 0.2 milligrams, usually PO, but you can give it IV or IM as well, Q4 hours. And the thing, what is Methergin for? So basically, you have a patient who is hemorrhaging or have increased bleeding. I need to stop that bleeding. I want the uterus to clamp down and do what it's supposed to do. So in order for it to do that, I'm going to give them this Methergin, 0.2 milligrams, usually PO for us. We give it PO Q4 hours, usually for 24 hours, so that we can help control this patient's bleeding. Now, there is a contraindication to this medication. It is hypertension. So if someone already has hypertension, high blood pressure, whatever, they are not supposed to get Methergin. Now, have I seen doctors give Methergin still? Yes, I have. I'm just letting you know that is a contraindication. Alongside with that, I'm going to tie this in together, is Hemorrhage. Hemorrhage is also something that we give for hemorrhage, okay? So when we give that usually IM, I believe. I think it's IM that we give that. Now, the contraindication for this is blood pressure and asthma. So be mindful if your patient has asthma issues, respiratory issues like that, or blood pressure issues, they're not supposed to get Hemorrhage either. Also, unwarranted side effect of Hemorrhage that we do not like is diarrhea. So Hemorrhage is usually one of the last medications they will choose or use when it comes to hemorrhage efforts to stop bleeding, is Hemorrhage, because of the side effects with the diarrhea, things like that. So again, those go together as number 7. Methergit and Hemorrhage, again, both of them are used to stop bleeding when it comes to you are having excessive bleeding. Number 8, Pitocin. Now, you know about Pitocin. If you don't know, in LND, they give Pitocin to augment or to induce labor, okay? We know about that. However, postpartum, especially for a C-section patient, we give, at our hospital, we give C-sections about 1 liter of Pitocin post-delivery, just to kind of help ward off anything from the bleeding aspect. Also, if we have someone who has had a history of hemorrhage, some physicians will go ahead and order prophylactically Pitocin, 1 liter, just to, again, ward off any of that bad, stuff, so we don't want a hemorrhage to happen again. And then, of course, when we have bleeding issues, when we have increased bleeding, one of the first things we do is start PIT. So we give them a bag of Pitocin, and typically we do that either while or before we start the Methergin and other efforts to stop the bleeding. So Pitocin, know that. Number 9 is a blood pressure medication. It's called methyldopa. I chose this one medication. There are several that we give for high blood pressure when you are postpartum. Labetalol is one of them for sure. But methyldopa, the reason why I chose methyldopa is because it is safe during pregnancy. So while the patient is already pregnant, she can take methyldopa while pregnant, and of course postpartum as well. That's why I chose that one, because it is safe during pregnancy. Know your blood pressure medications. Labetalol is another one, like I just told you. Methyldopa is another one. We don't do drips on postpartum. If they're requiring a drip of medication because their blood pressures are so high and they are beyond the mag sulfate and all the other stuff that we typically do, another video, then they need to be on another unit. They don't qualify to be on our unit if they're on some type of drip for blood pressure medication, like hydralazine or something. Number 10 is Zofran. Now, Zofran is used as an antiemetic. It's used to help with nausea and or vomiting. We give this to our patients when they are complaining of nausea and vomiting. Typically, our patients are C-section patients or surgery patients, the ones who need it the most, but any postpartum patient could potentially use this medication. This is usually our first line of defense for us. If you work in a facility in which you do something different, then it is what it is. But for us, Zofran is our first line of defense for nausea and vomiting. After that, we go to Phenergan. Phenergan is something that we don't like to use because of the fact it has the properties like a narcotic to knock you completely out, make you sleepy, causes respiratory depression and things like that. So that's the reason why we try not to do Phenergan. However, it can be used. And then number 11, which I told you was going to be 10, but this is the added one, is prenatal vitamins. Believe it or not, a lot of OBs still give prenatal vitamins in the postpartum period. So you will find that a lot of the OBs will, not all, because not all of our physicians do it either, but a lot of the OBs will definitely add a prenatal vitamin to the patient's med rec because of the fact that they want them to have the extra vitamins and things like that. In addition to that, keep in mind, they need iron. They have lost blood. When it comes to losing blood, typically about 500 is okay for a vaginal delivery and up to about 1,000 is okay for a C-section. Beyond those two numbers, we typically are running into the situation of having excessive blood loss, which we do not want. Those medications we just talked about earlier that help with maintaining or stopping the bleeding, helping your uterus contract. That's the reason why we want to make sure we restore iron stores. And one way to do that is prenatal vitamins and, yes, of course, iron supplements as well. So anyway, that is 11 medications that you should know if you are a postpartum nurse. Again, this was not all inclusive. You will learn more medications when you get on the job, but these are a good rundown. If you know these 11 medications, really 12 since I said Hemorrhage, if you know those 12 medications, you are well on your way to knowing the medications that most postpartum nurses do use in their everyday practice. As per usual, if you want to follow me on IG. It's on here. Also, your girl's on TikTok now, and I actually go live over there more often than I do. I haven't actually started here yet, but I go live over there answering nursing questions. So follow me on TikTok, and that is right here as well. And that way you can learn more about the questions I have over there. You ask me a simple question, I have a Q&A section over there, and I'll just simply respond with a video. It has seemed to help so many nurses or nursing students out, so I definitely appreciate those who come over there, or those who come over here from there, and vice versa. So if you happen to love this kind of content, definitely go over there, and I can get your question answered so much quicker than it is to actually sit and have time to do a video. I can be at work and just upload a video from work. So anyway, thank you for watching this video. Comment, like, share. Thank you so much. This channel is growing exponentially, and I appreciate you all. So until the next time, you all take care. Bye-bye.